Welcome to day 2. So today we're going to talk about my principles of rolling. And these are just 3 sort of guidelines that I came up with. They're not set in stone, but I find that they're good guidelines for rolling on your own. So the tools I'm going to use to demonstrate this whole series are just the regular foam roller, the pink bouncy ball or lacrosse ball. This is how you decide how to roll and how you move when you're rolling. So principle 1, for the least amount of intensity, you want to roll along the direction that the muscle runs. So and that's very general, and I don't expect anyone to know, you don't have to know anything about anatomy, but for the most part and for your need to know, just imagine that usually, when it comes to your limbs, the muscle runs the same as your bone. Yes, there are lots of muscles that run the other way, but for our purposes, just picture that muscle runs in the direction of bone. So what does this mean? So if you picture your biceps muscle, you can probably imagine that it goes from here to here. So if you want to roll it in the least intense way, you roll it in that direction. You want to think about your thigh muscles, they go from here to here. So you want to roll it in the direction that the muscle runs. Calf muscles, roll it in the direction that the muscle runs. So that's your first principle. So let me show you what I mean, for example. So if we're talking about hamstrings, using this first level would be rolling in the direction that they run. So I would be rolling towards and away from my knee. Towards and away. Okay, principle 2, rolling against the grain of the muscle. So to make it more intense, you roll in the opposite of the way that the muscle goes. So for example, this is level 1, rolling towards and away from my elbow because the muscles go that way. If I want to make it more intense, I'm going to go forward and back against the grain of the muscle. So that's to make it more intense. Let's show also with the hamstrings on the roller. So hamstrings, we know, run from here to here, or I'm telling you that they do. So then to make it more intense, you move the leg or you move the whole body so you're going against the direction of the muscle fibers, and it will feel different. The third level of intensity is to add movement. So then you apply pressure with the roller or with the ball, and then you do what the muscle does. And you just take your best educated guess. So let's use the triceps for example again. We're here, so we've been rolling forward and back. That feels good. We've rolled side to side. That feels good. We want more. So we're going to apply pressure and move the joint. And that's going to feel different. So this is the highest level of intensity. Okay, so those are your 3 levels of intensity. So when you're rolling, if you're rolling simply for the purpose of relaxation, you're probably going to stay in that level 1 zone where you're just rolling gently in the direction of the muscle fibers. If you're trying to work something out, you're trying to release a trigger point, then you're going to work your way up to 2 and 3. And you're not going to move to the second and third intensity until the first intensity feels totally fine. And this will feel different for all bodies, and it will come through consistency. So just like fitness, our goal here is consistency over intensity. If you go to town on level 3 on a muscle, your first day of doing this, you're going to be out of commission. You're going to be feeling it for a couple of days. So you want to stick with a consistent low level of intensity that feels good before you move on. So this means it could be uncomfortable, it can be tender, but it's not painful. You're rolling. So you're sticking with principle 1, rolling in the muscle fiber direction. When that feels, so perhaps on the first day, perhaps on the 5th day, it starts to feel better and that feels totally fine. Then you progress to the second level of intensity, which is going against the grain of the muscle fiber. And then when that feels totally okay, you can breathe easily while doing that. You don't feel pain, you feel much less tenderness. Then you can move to the third level of intensity, which is moving the muscle through its range of motion. Let me show you one more example for the third level of intensity. I'm also going to pull out this block, which I'll explain in a moment. So say that we've worked our way through levels 1 and 2, and now we want to add some intensity. I'm going to move the joint. So I'm going to kick my heel into the floor, activates the muscle. I feel it push into the ball and then release. And so I would do that until it feels like level 1 again, and then I find a new spot and I do it again. This is a yoga block. This is a great tool actually for rolling because it gives you some leverage. So you absolutely don't need it, but you can use anything that's a shape, right? You can use a box, you can use a cash box, you can use a book, anything. And the point of it is just to give you some leverage. So in one area of the body where it's really helpful is the triceps, like I showed earlier with the roller, because it gives you a bit of extra lift, and the calf muscles. Because, I mean, we got some meat on our calves, right? So we hide a ball under there, it's basically gone. So to give us a bit of leverage, put your ball up on something, and then you have a bit more room. Feels totally different. The block is also a great support, so it's great to have a block or a pillow even for lots of our rolling to support the head. So for example, if we're lying on the back, we're going to be rolling out the glutes. We want to focus our attention here. We don't want to focus our attention here. We want to be able to relax the head. So we are putting something under the head so we can focus all of our attention on what we're actually rolling. Another good example is when we learn tomorrow how to roll upper back. It's nice to have something to rest your pelvis on. So again, your body doesn't have to work so hard to hold you up while you're rolling here. And it's totally optional, but that's just another helpful little tool. So it's helpful to have something like a yoga block, a pillow, a firm pillow, or a book. We don't want to ever roll over bones or bony prominences. So that means not rolling over your spine, the spinous processes. If you feel in your back here, the bony bits that stick out in the back, you don't ever want to roll over those. You can roll over the musculature side to side. And you can roll over with a gentle roller over the ribs here, but you're trying not to stick on anything that's too bony, stay on anything that's too bony. You of course don't want to roll right over bones like your collarbones, your elbows, for example, your knees, but you can roll all the soft tissue around all those things. We always want to breathe through our rolling. If you're having trouble breathing or you're noticing you're holding your breath, that's a sign that you've gone too far, it's too intense, you need to back it up a little bit. So anytime that you're rolling, you want to find a nice diaphragmatic breath. So you're breathing in through your nose, ribs expand, diaphragm lowers, and you exhale, ribs draw in, everything draws in and up. You can breathe in through your nose and out through your mouth, or out through your nose. Breathing out through your nose tends to slow the breath.